anybody is watching, to the Fire Full Authority Annual General Meeting. We're going to wait a couple of minutes for some technical issues to be sorted with some members, and then we'll make a start.
Chair, can you read the messages on the side as well? Because Nikki highlighted something, please.
Just going into it. Thank you.
Chair, for some reason it says that I can't send a message in the chat because I'm not a member of the chat.
Okay. Any ideas? Councillor Sunderland, yeah, I've noticed your hand there. I'll come to you in a second. Any idea, Nikki, why?
No, I just wondered, have you tried Councillor Tate? You're on mute.
It doesn't let me click anywhere in the box.
The solution, Chair, may have to be to use the waving hand or simply to cease to make an interjection.
Okay, thank you.
Okay.
Just
to welcome Councillor Mahmood Akhtar, who's joined the meeting.
Oh, thank you very much.
Good morning. Congratulations for joining. Congratulations everybody really for joining. It's no technology behind this, so welcome. We're just waiting for one member who's got some technical difficulties, so I think we'll make a start if that's all right with everybody. So yeah, we are live streaming on YouTube. My name's Darren O'Donovan, and I am a Kirklees Council and Chair of the Authority. And this is the West Yorkshire Fire and Rescue Authority's AGM. I would just like members for now to mute their microphones, and we'll do a roll call one at a time. Sorry, I'm going to let Councillor Sunderland come in because I did miss Councillor Sunderland's raised hand. Councillor Sunderland?
It's the same problem as Councillor Tate. So I can't send messages in the chat either. I don't know if other people are suffering from the same thing, in which case we'll need to change the meeting rules.
Okay, so those that aren't able to, maybe if you all want to send a message into the chat and just check, fail in the chat if you raise your hand, if you wish to make a comment or ask a question, remembering that the chat box is there only to intimate that you wish to make a comment or ask a question, really, because if anybody's using the web-based version of this, they won't have the waving hand function. So if you want to just check your chat that it's taking your message, and if it isn't taking your message, do please use the waving hand. And I will just check, is there anybody out there who has double issues, that they are not able to use the chat and they are using a web-based system whereby they can't raise their hand? Is there anybody there that falls into that bracket? They can't chat and they can't wave. I will take silence to say that everybody's at least got a chat or a wave function for this morning. Yeah, everybody's there. So I will do a roll call if that's okay. And I will do my best to flick between chats and waving hands. So I'm just going to go down the list as it appears on the screen. So as you hear your name, if you just unmute your microphone and tell me that you're here, or tell the public that you're here. Ron, you've got your hand waving. Do you have a comment to make at this time?
Test, but you did just 5 minutes ago. Okay.
Test. Thank you, Ron. So I'll take Ron as number one. Ron is here loud and clear. Next on my list is Nick Smith.
Yeah.
And Michael Barnes.
Yes, Chair.
And Alison Davey.
Yes, Chair.
And Gail Seekins.
Yes, Chair.
Thank you. Dave Walton.
Yes, I'm here.
Ian Brandwood.
Yes, Chair.
Louise Johnson.
Yes, Chair.
Nazrul Chowdhury,
I'm here, Chair.
Dick Townsend,
Yes, I'm here. Hi.
thank you. Caroline Anderson,
Yes, Chair.
Angela Tate, Councillor Tate, sorry,
Yes, Chair.
Councillor Wenham,
Yes, Chair.
thank you. Councillor Hall,
Present, sir.
Councillor Almas,
Good morning. Yes, Chair.
thank you. Councillor Sunderland,
Yes, Chair.
thank you. Councillor Renshaw,
Yes.
thank you. Councillor Akhtar,
Yes, Chair.
thank you.
Aye.
Councillor Pollard,
Present, yes, thank you.
thank you. Councillor Mohammed,
Morning.
morning. Councillor Mohammed, thank you. Councillor Downs,
Yep.
thank you. Councillor Tully,
Yeah, I'm here.
Councillor Shaheen,
Yes, Chair.
thank you. Councillor Jenkins,
Yes, Chair.
thank you. Councillor Curtin,
Yes, Chair.
thank you. We've got Joanne Ryan,
Oh, sorry. Morning.
hello, thank you, Joanne.
Thanks.
We've got Luke Watson, is Luke Watson with us?
He's doing the recording separately.
All right, okay, thank you. We've got Mark Squires,
Yes, Chair.
thank you. And Nikki Hausman,
Yes, Chair.
Noel Rodriguez,
Yes, Chair.
Councillor Harrand,
Yeah.
thank you. Councillor Graham,
Yeah, thank you.
thank you. Councillor Austin,
Yes, Chair.
thank you. And Councillor Fenton Glynn.
I'm here also, Chair.
Thank you. So just for the purposes of the public that are watching this, the icon that you see of a boardroom in the shape of a letter N, you will see senior officers of West Yorkshire Fire and Rescue Service who will come in at different points through the agenda. And we have officers here from IT to support what we're doing this morning, and Michael Barnes and Nikki Hausman, who are from our Legal and Governance Department. There are other officers here as well that we will learn about as we go through the agenda. The rest of the icons are elected councillors from throughout the West Yorkshire District Councils. So we'll get moving then. Item number 1, apologies. I've received no apologies. I just know from a message that Councillor Pervez has some technical issues this morning and hopes to join us. Item number 1, this is the AGM, so this is the appointment of the chair. So I'll ask.
Move it, Chair. Move yourself.
So Councillor Graham moves.
Second, Councillor.
Chair, that's seconded.
Second.
Seconded.
Seconded. Thank you, everybody. I will now accept that position of Chair Authority for this year. Thank you. Unless there's any comments. Item number 2, appointment of the Vice Chair. I move Councillor Steve Tully as the Vice Chair.
I second.
Oh.
Okay, so Councillor Steve Tully has been moved and seconded as the Vice Chair of the Authority for this year. Everybody happy with that?
Thank you.
No comments?
Thank you.
Thank you.
Thank you, Steve. Item number 3, announcements from myself. The only announcement really to make that we've already said is that this is being broadcast live on YouTube. So please do bear that in mind this morning, members, officers, but the public are very welcome to be with us this morning. Item number 4, admissions of the public. Everything on this agenda is in the public domain. There is no exclusions of the public. Item number 5, urgent items. If I can just come in here, members will have seen an email asking for consideration of the change of date for September, December and February's full authority meetings. The updated version of that is that September's full authority meeting will be still the date advertised in your records. The full authority meeting in December will be the date as advertised in your previous documents, no change. The meeting in February will change its date. It'll just be one of the 3. So rather than the meeting being on the Friday, I'm just going to flick through my dates now. So rather than the meeting being on Friday the 26th, the full authority meeting will be on Thursday the 25th. Everybody happy with that one? Change?
I've got interference here, Chair, on the sound. I've got interference on the sound, Chair.
Okay, I'll just check if everybody can just mute their microphones. Just double check that their microphones are muted. Hopefully that'll get rid of any interference. Okay, does anyone have any questions or queries around that date change for February? Okay. Let's have a look. Yeah, I don't see any comments or any raised hands, so we'll move on and just take that date change for February. Any declarations of interest from members to declare? Please let us know now. Let Nikki know.
No declarations, Chair. Councillor Graham.
Thanks, everybody. Item number 7, membership authority and committee membership and other appointments for 2021. Michael, do you want to take us through the amendments on this?
Yes, Chair. What we have done compared to the normal agenda layout is to condense several reports into one. And what you will see is that the report sets out that in effect there are no changes to the decisions made on appointments last year, save in the appendix. So the Section 21 members, i.e. the authority spokespersons on the constituent councils and the community safety lead members, it is proposed remain the same. You are the existing member champion for mental health issues, and it is proposed that you continue with that role. There is a need to consider the appointment of a member for diversity and inclusion for the oncoming year. The outside bodies, the proposal is that the membership remains unchanged, and the membership of the FRA committees and the chair and vice chairs of those committees remains unchanged, save for a change set out in the appendix, which is that councillors Hall and Harrand effectively swap seats on community safety and audit. So that's it in a nutshell.
Okay, thank you. Can I add then that I would like to invite Councillor Almas and Councillor Wenham to be joint equality and diversity champions for the authorities. Is that okay with Councillor Wenham and Councillor Almas to share that role this year alongside the mental health champion?
Yes, I'm okay with that, thanks.
Yes, Chair, thank you. Happy with that.
Okay, so we agree on those 2 appointments, and we agree to make those changes to the membership of the Audit and Community Safety Committee as explained at Annex A, page number 7, unless anyone's got any questions about that. Thank you. That's approved. Item number 8, which is on page number 9, are the minutes of the last meeting back in February. Just those, and item number 9, any matters arising questions from the minutes of the last meeting in February that members would like to raise. I don't see any comments. I don't see any raised hands. Okay, so we'll approve those minutes. Item number 10 is the minutes of the committee meetings held since the 21st of February and other outside bodies. Minutes for these meetings have been sent in a condensed version to members ahead of time for their consideration. Michael, is there anything else you want to add?
No, I've got nothing to add, Chair. I hope the members have been able to read them. We did send them out as paper copies as well as the PDF links for ease of reference.
Yeah, so we asked or made an offer that if there were any questions from those minutes that you could submit them ahead of time for today. We've not received any so far, but just for clarity, is there any question from any members on any of those committee meeting minutes that you've received that you'd like some clarity on?
Yes, please, Peter Harrod. Yes, please.
Yeah, I'm sure.
Peter Harrod.
Councillor Harrod, yes, absolutely.
I put the question, don't expect the answer now, I can come later, I understand the rules. Page 17 of this separate pack, the very bottom paragraph says comprehensive spending review, and if somebody could do me a one-page note where we are on that and where it is in the Whitehall system and what impact it might have on us. It looks to be the sort of thing that creeps up on you and grabs you when it's too late to do anything about it. So if somebody can do a, I don't know, Alison perhaps, one-page summary of that, I'd be grateful. Thank you.
Yeah, I'll just give a verbal update on the comprehensive spending review. As members know, that was during April 2021, and we would have got a 3-year multi-settlement deal. It's kind of likely due to COVID-19 and parliamentary time being taken and other things that it's more than likely that we'll just get another rollover budget as we have done in 2021.
Thank you.
Is that okay, Councillor Harrod?
That's fine. Thank you.
Thank you. Thank you. Any other questions or queries on any of those minutes before I move on?
I believe
No.
Councillor Renshaw has a hand raised.
Oh, Councillor Renshaw, sorry, I don't see it. Oh, it's just popped up. Yeah.
Thank you, Chair. I'd just like to ask, following on from those minutes, whether or not we charge any of the outside bodies for any of the services that we provide, like for Yorkshire Water, for the safety measures that we provide within communities. And I know that goes on because it's gone on in my ward. So I'd just like to ask if the Fire Authority does receive any incoming from.
Thank you, Councillor Renshaw. Alison, are you best to answer that one? Do we receive any fees, any revenues from Yorkshire Water or other bodies that we might have to do work for?
Not that I'm aware of, Councillor Renshaw. If you can give me a bit more detail to your question, then I'll be able to have a look into that.
They've recently done some. Oops, sorry. It keeps muting. Does my microphone? Sorry. They've done some safety measures around the reservoir within my ward, and I just wondered if they charge Yorkshire Water for providing that service. And I know it must go on in other areas where there are such things as reservoirs and big areas of such water safety. The Fire Authority have taken a lot more part in, much greater part in this year.
Thanks, Councillor. Dave, did you want to come in on this one?
Yes, if I can, please. If I'm understanding Councillor Renshaw's question correctly, the members will be aware that we've conducted various safety campaigns throughout the year and continue to do so, particularly at times like this when the weather is warm, to discourage people from playing or using reservoirs and lakes. in a dangerous way. Often as part of that, crews will either patrol the area or maybe even do our training in the area because it's relevant and often a deterrent if we're in the water. But that's not an activity that we would charge for. It's a community safety activity and sometimes a training activity for ourselves as well.
I do appreciate that it's community safety, but this has actually been a reservoir that's owned by Yorkshire Water, and I know that Yorkshire Water charge for services that they provide. They charge people like the council for services that they provide within that area. So I just wondered if the fire authority would charging Yorkshire Water for the community safety that they're inputting.
Maybe if I could come in here, Councillor Renshaw or Dave, I think what we want, Dave, is maybe to come back with, a bit of confidence that organisations like Yorkshire Water maybe are taking their responsibilities for securing their sites the utmost to safeguard any kind of water-based accident. So I totally understand that there's a number of water-related features around the area that present different levels of risk: rivers, canals, reservoirs. But I think what Councillor Renshaw, what we could drill down to is just getting some confidence that although we might not be able to charge as such for that kind of protection across all water areas, that you get some confidence from Yorkshire Water and others that they are doing all that they can to protect the public from entering and staying safe in their water assets, if we could put it that way. Does that make sense, Dave?
Yeah, yes, it does, Chair. And I'll perhaps pick up on an email conversation with Councillor Renshaw after and just make sure I'm answering the question exactly, but also to give that confidence as well.
Is that okay, Councillor Renshaw? Because your microphone is going in and out a little bit there.
Yeah, it went in and out then, so I've moved my mouse totally out of the way. Sorry. Yeah, because Yorkshire Water are charging the council for services that they're providing, and yet the West Yorkshire Fire Authority are involved in some of that safety work. So I just wondered how much the fire authority were actually charging the Yorkshire Water for, and I know that must go on throughout the whole authority, and we've got to provide our income for the fire safety element of it, and considering the 10 years of austerity that we've already had and the cut downs that we've had in our budget, I think that it's something that we could probably look at.
Okay, Dave, did you want to come back in again, or Michael? You both raised your hand.
I've got nothing to our chair just now. Michael's got his hand raised, yeah.
Well, the only reason I've got my hand raised, Chair, is because I wanted to notify you that I'm not sure whether we've lost Councillor Graham. He appears to be waiting in the lobby and has been for a while. I'm not sure there isn't a technical fault.
If I can, Chair, I've just sent him a message. He needs to restart his browser, and I've just left him a message on his phone.
Okay, Chair. Well, he's back.
Councillor Graham, you're back.
Thank you, Michael. I've been sat here like a lemon while all this interference has been going on. I'm getting pissed off with it.
I just ask members just to mind their language as we are broadcasting live. Sorry, yeah, I think members are experiencing some technical issues with their equipment, but thank you, Michael, Nikki, for helping Councillor Graham to rectify that problem. Welcome back to the meeting, Councillor Graham. Councillor Graham, we're just on the minutes of all the committee meetings that were condensed into item number 10. Were there any questions that you had on any of the committee meeting minutes that you wanted to raise?
Item number 10, Chair. Where are we? Oh, I've got it now, Chair, yeah.
So this is the condensed minutes of audit, community safety, local pension board, etc. If there are any comments you wish to make on any of those before we move on.
No, move on, Chair.
Move on. Okay. Thanks, everybody. Nobody else has intimated to speak or ask a question. We've got Councillor Graham back, so I'll move on to item number 11, which is the authority constitutional review and proposed changes to local pension board membership to approve and changes to the financial procedure rules. Michael and Alison, who wants to go first?
Well, I'll start, Chair, just to say that the pension board changes are as requested by the pension board and supported by the HR committee. And in essence, it's basically to add to the membership and define the constituencies that they will represent. So you'll see that there's to be a specific representative of the FBU, and there will be an officer who joins the two members representing the authority. I'll leave it to Alison to explain the changes to the financial procedure rules.
Yes, so Chair, yes, so they're just simple change really to the financial procedure rules, just to make it a lot simpler. So the first one is allowing finance resources to actually move budgets up to £1 million. As we've gone along, we've actually started revising the budget midway through the year. So rather than waiting for full authority, I've just asked for finance resources to actually do that. And just some minor wordings to presentation of reports, so both capital and revenue, and just some changes to contract procedure, thresholds, which are in line with European regulations.
Thank you. Got a question from Councillor Sunderland.
Thank you. It's about the increase to the amount of money you can change. It says it's going to be reported to finance and resources. Is that in advance of the decision or after? Because I think it just needs to be clearer then. If it's happened and it's just a report to tell you, then it should say so.
Yeah. Okay. Noted. Yeah.
Thank you. Question from Councillor Pollard.
Yeah, thank you. Two items on that one. Just regarding the increase in transfer of resources and the contingency from £500,000 to £1 million, what level of pay increase, for example, would actually trigger a requirement to get over 500k in the contingency there? That's the first one, and might as well sort the second one on somatic. Overleaf. Section 21.2, the question of purchase orders to the value in excess of 75,000, which aren't contract items. Could you say how many contracts and what value were handled on the old basis in the last financial year, for example?
So in answer to your first question, so a 3% pay award for greybook staff would be £500,000 and 100,000 for support staff, so it could be in excess of 500,000. In answer to your second question, this could be a one-off purchase order of 75,000. I haven't got the figures present about the number that was actually done in 1920, but I can certainly find that out for you, Councillor Pollard.
Yeah, if you could get me those figures, that would be good. Thank you.
Yeah.
Okay. I don't see any more hands or any more comments, so I'll ask the change to the local pension board membership. Oh, no. Sorry. No.
Can I just ask a question, please?
Sorry, Councillor Harron, yeah, just seeing it.
It's about the very last red edition on this paper. It talks about two people no longer being present for opening contracts, quotations and tenders. Is that all right with internal audit? Are they happy with that?
Yes, Councillor Graham. So we've actually moved to an electronic system, and there's actual internal audit regulations actually built into the system. So it doesn't allow somebody to open the tender until the due date. So there's lots of controls in the electronic system. Previously, it was just a handwritten system where we actually see the tender by post. So we did require two people to be present, but because it's electronic system, there is actually controls in the system.
If internal audit helps you so much. Thank you.
Thank you, Councillor Harron. Okay, if there's no other questions or comments, we will move and agree the changes set out in the annex to the local pension board membership and the changes to the financial procedure rules. If everybody's happy with those. No more questions.
Move it, Chair, move it.
We will approve that item number 11, those changes. Thank you, everybody. Item number 12 is a verbal update on West Yorkshire Fire and Rescue Service COVID-19 performance. John, are you taking that one?
Dave's actually going to present this one, Chair.
Okay, over to you, Dave. Thank you.
Yeah, thank you, Chair. The update I've got in front of me is going to take about 10 minutes to deliver it. Members will appreciate there's a lot of information to share with you. Perhaps if I suggest we take questions at the end, if questions arise from what I say.
Yes.
Firstly, just for clarity, I would confirm for members that we do consider ourselves still to be in a response mode in the context of the virus. We are actively talking about recovery and taking measures to plan and deliver it, but we do remain in a state of enhanced vigilance, and we do keep the command structures in place that we had to deal with the peak of infection, albeit we have now started to decrease the frequency of them. The service has had a plan for dealing with the influenza pandemic for some years, as per a national risk that we all planned for. We have had to adapt that plan to deal with the fact that the cause of the infection was a coronavirus and not a strain of influenza. However, all of our experiences over the last 3 months or so will inform a revised version of that plan, which we're working on now. Whilst we had discussed the growing issue pretty much since February, when we all started to see it on the news, as we watched it spread in the Far East, we first met to formally discuss our response in early March. Prior to this, we dusted off the pandemic plan already, checked it over, and management team members had familiarised themselves with it. Our first crisis management team sat on the 11th of March. That was the day that the UK Chief Medical Officer raised the risk level in the UK from moderate to high, and the crisis management team has sat 15 times since then. That was also the start of the week when we saw the introduction of extraordinary measures around when staff should stop off work. The start of the daily press conferences came on the 16th of March. The Prime Minister's advice at that first one of those was that individuals should refrain from non-essential travel and to work from home where possible. We also saw an announcement that schools were closed with effect from the 20th of March. Shielding was announced on the 22nd of March, and the wide-scale lockdown was announced on the 23rd of March, coming into full effect on the 26th. This changed, as members will be aware, some of the if you can messages to you must messages, which is where we saw the most significant changes. Those 2 weeks that I've just referred to saw a massive and fundamental change to the way we operated the service by necessity. We did that with a few general guiding principles as we worked our way through the challenges. Firstly, the emergency response must continue, though we needed to adapt how we did it to ensure the safety of our staff. This included the need to socially distance and maintain appropriate hygiene. Secondly, we took the decision that everybody who could work at home should work at home. We accepted that some people had to be at home but couldn't really do a full range of meaningful work, or indeed any at all in a few cases, but their personal safety was paramount. And thirdly, all services such as fire prevention, safe and well visits, fire protection visits and operational risk visits would not be stopped in their entirety, but we would only visit the very highest risk when there was no other alternative, and that we will continue to do it in a safe way for both our staff and the community that we were visiting. By taking this approach, we gave ourselves the space after those first couple of weeks to stop and think. Those 2 weeks were very busy indeed, and we were very much reacting to what was coming from government. In many cases, we heard things for the first time at the 5 o'clock press conference and had to act immediately. Throughout everything that we've done, we've been engaged at a national level through the Local Resilience Forum. We've taken part in daily West Yorkshire Strategic Coordinating Group meetings, and we've also been part of the weekly National Fire Chiefs Council Coordination and Update meetings. We've also had to submit data to a number of those bodies on a daily basis about how we were working. Fairly early on, we were given a set of what were called reasonable worst case scenario planning assumptions in respect of the predicted impact on staff absence. Those planning assumptions suggested that we should plan for a peak staff absence at any one point of something in the region of 20%. We modelled this and we're confident that we could maintain a risk-appropriate level of service operationally should that be realised. In actual fact, our peak absence has been 8.36%, and we reached that on the 31st of March. This figure includes actual sickness with COVID-19 symptoms, self-isolation, and those who were shielding because of conditions affecting them personally or because of conditions affecting those that they live with or care for. This figure is currently under 3%. As of yesterday, we only had 2 people absent with coronavirus symptoms. The rest were members of the shielding cohort. We did make some very early decisions to allow the cancellation of leave up until the end of June to improve the staffing situation, and also a recognition of the fact that leave under lockdown conditions was limited in how staff may enjoy or benefit from it. This has created us a bit of an issue going forward over the management of leave. We have offered the staff the chance to sell up to 5 days back to us, or in line with national guidance to roll it forward until next year. We've also ensured that staff could readily identify themselves as key workers so that if they chose to, they could take advantage of the ability to send their children to school. We took an early decision to lock down fire control with probably the strictest lockdown procedures imposed anywhere in the organisation, recognising the criticality of that particular function. And we also trained extra staff to support fire control should sickness peak at a more challenging level. And I'm pleased to say we haven't had to use those extra staff. We established a COVID-19 support cell to provide specialist support and advice from a very early point. This has served us well and provided a centre for support and expertise where many headquarters departments were working from home. The cell developed a daily brief and oversight on levels of absence and emerging issues that required decision, etc. The cell also worked very effectively when testing for confirmed cases of COVID-19 became possible. We were and continue to be able to get very effectively and quickly provide our staff with access to a test that's usually the same or the next day, and to get results back usually within 24 hours. We have seen one station where we saw anything approaching what might be termed an outbreak, and we had a specialist deep clean arranged within 24 hours at that station. We've not needed to do that since that situation. We continue to monitor this. Members should also be aware that a portable testing station has been hosted at Halifax Fire Station throughout much of the pandemic as well. The level and type of incident-related activity has remained broadly consistent with the same time last year, and that is a picture that is replicated nationally as well. We had an initial spate of moorland wildfires and secondary outdoor fires due to what was at the time an extended dry and hot period. It's certainly gone wet again in the middle, but we're getting a similar dry and hot period now as well. So that provided us with an opportunity to test our new ways of operational working and revise command under what we might call stress conditions. We did make some minor tweaks, but broadly speaking, our arrangements have served us well. It's also worthy of mention that we've had 3 fatal fires in this period, all domestic related, none of which had any overt links to the situation created by the pandemic. We took an early decision to speed up what was an existing piece of work to replace much of our desk-based IT with mobile laptops and tablets. We purchased extra equipment and prioritised the work of the ICT team in this area, as we saw this as one of our priority areas in terms of business continuity. We've issued 140 new laptops on top of the existing programme, and we've rolled out Microsoft Teams, which we're using now ahead of schedule. And it's of note that the ICT service desk have also reported there's been a 3rd increase in support calls as we've helped people to adapt to working at home. We have been provided with 2 grants from central government to support us through the pandemic. Those grants total £2.1 million. Grants are intended to replace any lost income or to support us in the range of activities we've undertaken to support the community beyond the scope of what we normally do. Work has been done at a national level between the National Fire Chiefs Council, the LGA and the Fire Brigade Union to develop a series of agreements where firefighter skill sets could be used to support vulnerable people. Whilst there's not been the local demand for us to support all areas of that agreement, we have been very active in some of the other areas. We did establish very early on a list of those offering to volunteer and do extra roles. The list included individuals from all teams, different roles and locations across the service and amounts to over 600 people. The range of activity undertaken has included the collection and delivery of prescriptions, food parcels, shopping and personal protective equipment. We've had staff driving doctors and nurses in the community, and staff who will respond to lift people who have fallen at home but need a lift to get up. We also developed 2 teams to support Yorkshire Ambulance Service and the temporary mortuary facility in Leeds. 12 staff became part of the Yorkshire Humber Fire and Rescue Service team of 48, who were trained to drive ambulances between local hospitals and the NHS Nightingale Hospital in Harrogate, where the most seriously ill patients would need to be moved. And we also have a cohort who are trained to work at the temporary mortuary facility in Leeds. Fortunately, the impact locally has not required us to activate those arrangements, but we should be proud of the way that our staff have stepped up, and those arrangements remain on hold should there be a second peak in the pandemic. Our communications team have been one of the busiest, given the amount of information that we needed to share very rapidly. We have introduced entirely new ways of communicating to reflect the fact that people were working from home, and certainly in the very early days, many did not have access to their usual IT or face-to-face meetings with managers. As I previously alluded to, government press conferences at 5 o'clock in the afternoon gave us issues that we had to manage that affected what some people did the very next day. Fundamental messages such as "don't come to work" need to be communicated very quickly. A system has been developed that will send a text link to our Burning Issues magazine online, and we've used this to great effect to tell staff that there is something that they need to read now, and to give them the means to read it on their mobile telephone. The process was further supplemented by the development of podcasts to share important information concisely to keep staff informed. We've also delivered a series of managers' briefings and sessions for staff working from home by Microsoft Teams, all of which seem to be well received and have engaged staff. Thought it might be useful to share some of the scale of the communications activity with you. Internally, Burning Issues has issued 29 editions since March the 18th. Podcasts are getting over 2,000 listens per podcast. The manager and staff briefings about over 850 participants. The staff survey, which I'll talk about later, over half of our staff completed. And the section of our intranet, Fire Hub, has a specific area devoted to Corona. That's currently averaging some 10,000 views per week. It peaked at 16,500 views a week early in the pandemic. Externally, our social media continues. We've generated over 4.7 million impressions on the main Facebook and Twitter accounts, and we've generated over 5,000 new followers across our platforms. Campaigns have carried on, such as Stay Safe, Stay Home. We've reached over 300,000 people with our Clap for Carers videos and photographs. And relaunch for 2020, in particular relevant now, is the hashtag Be More Aware campaign. And we've supported the National Fire Chiefs Council with their national campaign around firefighters being ready, willing and able. Particularly with the interventions team who have provided resources for children and young people stuck at home and unable to access friends and their regular support activities. There has been an enormous amount of extraordinary work done by so many teams to deliver their work differently and innovatively in support of our response to the crisis, and it would take up too much time to mention them all. But I don't want to start a list and then start leaving people out. Most recently, we've started to plan and undertake our recovery and to plot our way to a new normal. A separate group has been set up, led by ACO Nick Smith, to consider and deliver our approach to recovery. This group is running in parallel to the work that continues in crisis management team. And our general approach to recovery can best be described as follows. Firstly, there is no rush for everyone to return to work who has been working from home. Secondly, we will make sure that all of our workplaces are COVID secure in line with government guidance, and that includes taking a fresh look at the sites that have been open throughout. Only then will we consider people returning to work. Thirdly, we will not be requiring individuals and teams to catch up work that has been missed or that has stopped, and we'll work with them to agree the best way forward. And finally, we seek to learn from the whole experience. This will inform the response to any future second wave or a similar event. We also think that the requirements and necessity to work differently may have realised improved ways of working that we will maintain and develop in the longer term. As I mentioned earlier, in support of our longer term plans and our learning, we've recently conducted a survey of all of our staff to capture their thoughts and their individual learning. Still working through the results, but in the most general of terms, most staff seems to think that as an organisation, we have managed and adapted well, and that we have a lot to be proud of. Communication in itself has been an issue, particularly in respect to the amount of it, which was unavoidable, but importantly the view that we've delivered it well and that new ways of communicating have been well received. We have got to reset and re-evaluate many of our longer term projects, and this remains work in progress. We do want to understand whether the intended benefits are still required in the post-COVID world, or whether our experience suggests that we should deliver something different. Finally, and in closing, I'd also say that we must not underestimate the impact this situation has had and will continue to have on the health and well-being of our staff. Whilst, of course, that includes those who suffered physically, having become infected by the virus, there is also a wider impact on mental health. People have been isolated at home, sometimes not in ideal circumstances for them personally. The nature and type of their work has changed. Huge uncertainty has been introduced into all of our minds, with friends, relatives and colleagues being missed. And people are worried about the impact on them should they or someone close to them contract the virus. There has been grief for some, illness for others, and the whole range of personal emotion that goes with all of that. Many are understandably nervous as they contemplate leaving home for work or emerging from shielding, uncertain as to what awaits them. We've encouraged regular contact and dialogue both from managers and friends and peers who've spoken in our podcasts about the importance of good mental health and the self-help tools that are available. The site that I alluded to on our intranet devoted to COVID-19 has a wealth of resources available to support and inform staff. Our occupational health team have continued to work from home and support individuals, and our employee assistance programme has been regularly signposted and talked about in briefings. We do see that there will be a long-term requirement for both support for those who have remained at work throughout and for those who have had to work from home. We haven't missed a single emergency call. We've helped everyone who needed our help and supported them in whatever way we can. Our staff have adopted a can-do attitude throughout. Staff at all levels are to be thanked for what they've done. The front line have delivered. Managers have supported and given leadership to those and those in support roles have done everything required to ensure that we're able to keep doing what we do. Whilst it isn't over yet, we do believe that we've done okay. We have learned a lot, and as a management team, we are very proud of all of our staff. And I'll leave that there. Thank you.
Okay, thank you, Dave, for that comprehensive rundown. John, do you just want to come in? I'm just mindful of the time, but do you want to come in, John?
Yeah, it was just for awareness, Chair. Some people, members of the authority may not be aware, but Dave is one of the co-chairs of the Local Resilience Forum for West Yorkshire. So I'd just like to place on record my thanks for Dave's leadership from an LRF point of view, but also as members of being aware that I was ill during the start of the pandemic with coronavirus, and certainly Dave's leadership for the service has been outstanding. So I'd just like to say thanks and place that on record.
Yeah, thanks, John, and yeah, thank you, John, thank you, Dave, and all the senior leadership team and everybody within the service. I'm sure these thanks will come a little bit later on as well, but it's no mean feat responding to COVID-19, reconfiguring what we do, reconfiguring our outward services while still protecting our staff. So well done, congratulations to everybody for getting us this far. I am conscious of time, but I just want to open up questions to members if you have any.
Councillor Graham.
Councillor Graham, yeah, sorry, Ron. Councillor Graham.
Okay. My apologies to the guests we have today, Chair, but it frustrates me when if there had been any voting, it could have affected the voting. That's why I'm upset about it. But the second thing is now where the land management is concerned. We discussed this only recently after the recent fires on the moorlands and what have you. I'd like to know what action is taking place there. And my second point is that where the cross-contamination is concerned, what happens where the cross-contamination, where the cabins are concerned? What do we do about that? Yeah.
If I might take that, Chair, it's Dave Vaughan, I'll take that in two parts. Firstly, land management, I believe Councillor Graham is referring to moorland areas, etc. We have been working closely, particularly with National Trust and the councils who own areas of open moorland, and also I believe it's called the Moorland Owners Association. Members may be interested in fact that we've continued to work on our wildfire response and invest in it. And this evening's Look North at 6:30. All being well, we will be live from Marsden Moor demonstrating some of the work we've been doing with the National Trust and also demonstrating some of the new equipment that the authority has invested in to enable our response being better. As regards to the cross-contamination of crew cabs, which I believe Councillor Graham is referring to as well, this is an ongoing piece of work at a national and local level as well. It's regarding the contaminants that firefighters pick up on their fire kits whilst in attendance at incidents. We already have a series of existing protocols to manage that. We are just commencing a new project to design our next generation of fire engine and those next fire stations that we are due to build. And an individual has been tasked with that very specific piece of work to make sure that we take all of the national learning and our own learning and provide for as safe and as hygienic a working environment we can, including crew cabs for all of our staff.
Okay.
Thank you, Chair.
Thank you for that. I'm going to go to Councillor Pollard.
Thank you. Just an odd query from what Dave was saying. The maximum absence levels, and particularly with regard to the control room, which was locked down very heavily. What was the maximum absence rate in that control room? And did we get called upon by any of our neighbouring authorities for assistance where their control rooms came under heavy pressure?
In terms of the statistic, Councillor Pollard, the maximum number of staff we had off in the control room, which was both those with COVID symptoms and those that were shielded, was 10. And that represented 21.75% of our workforce. But I think it's fair to say that the contingent plans that the station manager in control put in place made sure that we managed that situation effectively. In terms of requests for assistance, I don't know that Dave may want.
Yeah, I can pick that up, Chair. No, we didn't have to assist any services in respect of running their control room, as it were. Probably worthy of mention, in amongst all of the other things that we've been doing as well, we've provided quite a lot of support to South Yorkshire on an operational basis. For you may have seen they had a moorland stroke forest fire, and I think Hatfield Forest is called. So we had quite a heavy commitment there, which we were able to manage within our existing capabilities as well. That wasn't related to control, that was just operational response.
Thank you. Is that okay? So we've got, I'm very keen that we must get to item number 13 in the next sort of few minutes. So we'll ask Councillor Mohammed and Councillor Sunderland to ask their questions. If I can ask officers to be pithy in their response so we can get to item 13, because I know some members do have to leave this meeting before 12 o'clock. So Councillor Mohammed.
Yes, my question was around community safety issues, and I just wanted to ask if any work was being done digitally with schools, as more families are having to spend time at home, and under the unprecedented circumstances that we're in at the moment, there's a lot of pressure, and that is going to lead to little accidents happening at home. So I'm really keen that we tap into resources that are available to us. As a parent, I know myself that school is regularly in touch with my children, and they are sending them messages. So I'd be keen for us to kind of tap into that and send out messages of how to stay safe at home.
So if I may, Chair, certainly yes, that's something, and again, alluded to the youth intervention team, they have reconfigured the type of work that they do completely. And much of that has moved to a digital platform and increasingly does so as well.
Yeah. Thank you. Thank you. Councillor Sunderland.
Two issues. Firstly, it would be remiss of me not to say thank you for the very substantial and effective work that's been carried out by all members of the service. You've clearly worked well above and beyond the call of duty, and it would be wrong of us all not to just place on record our thanks. But looking forward, or perhaps a slight look backwards to look forwards, is there a plan to have a review as a sort of a lessons learned type exercise, particularly as we are going to have a plan moving forward where we look at when there's maybe a local lockdown?
Nick, can I take that? Yeah, Councillor Sunderland. So part of the recovery group has initiated a number of means to start to identify the lessons learned. So we've already carried out an over-the-bonnet review. So that's a staff survey and a departmental questionnaire to try and identify those initial lessons. And we've got a subgroup now that's been established, debrief and learning subgroup. So they'll be carrying out a more fundamental debriefing process for the whole event to ensure that organisationally we learn, we improve our plans, and we also capture some of the good practice and innovation that's taken place so we can develop our service moving forward. So that's all in train, and we'll commit to provide an update to the fire authority as we progress through that.
Thank you very much.
Okay. Thank you, everybody. So yeah, we echo the thoughts and sentiments. The thanks for all the staff for all they've done in reconfiguring the service and delivering and keeping West Yorkshire safe. So thanks, everybody. We move on now to item number 13, which is for the decision. So we must get to that vote before we leave the meeting. Nick, do you want to take us through the IRMP proposal, the relocation of Cleckheaton Fire Station up to the HQ site?
Yes, thank you, Chair. Good morning, everybody. So just to reiterate the Chair there, this report is seeking approval to conduct an 8-week consultation. So at this point, we're seeking approval to conduct a consultation exercise that will run from the 25th of June to the 20th of August, and then we'll report the findings of that back to yourselves at the Fire Authority on the 18th of September for your consideration, should you approve that consultation exercise. Before I give an overview of the proposal, it's just probably worth reminding members that under the Fire Rescue Service National Framework, there is a requirement on the Fire Authority to carry out an integrated risk management plan. So in its simplest form, an integrated risk management plan is a review of how the service is deploying its resources to best manage the risks facing the communities of West Yorkshire from fire and other emergencies. So the outcome is to try and maximise the safety of our communities. As the Chair's pointed out, this IRMP proposal deals specifically with the location of the fire appliance that's currently based at High Town Road in Cleckheaton, and the proposal is to relocate that fire appliance and the technical rescue vehicle and the staff that work there to our headquarters here at Birkinshaw. So, in terms of Cleckheaton Fire Station, that's our oldest fire station, it was built in 1952. We have carried out a feasibility study of that station, and it's no longer cost effective to refurbish it, and it needs a full rebuild. That's been presented to the Fire Authority, to the Fire Finance and Rescue Resources Committee, in February, and it sits within our capital plan. However, before we commit to such an investment and expenditure, it's only right that we carry out a review of whether that's the most appropriate location for that fire appliance and those firefighters. It's probably also worth pointing out that Cleckheaton not only provide a fire cover, they provide the technical rescue capability for the county, and also the national asset in terms of the urban search and rescue capability that they provide. That second part of their role, the urban search and rescue capability and the assets are located here at our headquarters. So currently Cleckheaton spend their time between the fire station at Cleckheaton and headquarters to deliver both of those capabilities. I think when we've looked at the option to relocate the fire plants to headquarters, because they already have accommodation up here, we could significantly reduce the cost of building that fire station. So we'd be extending and adapting the accommodation they've got, which should save significant amounts of money in terms of £1.6 million from the capital plan. So a rebuild at Cleckheaton would cost us £2.9 million. To adapt the accommodation at headquarters, we foresee that cost us in the region of £1.3 million. So significant savings from this proposal. But most importantly, I suppose, its relocation would see an improvement in fire cover for communities in the area that are most vulnerable from fire. So authority members will be aware that we map the risk of fire across the county, and depending on the vulnerability, we decide areas to be very high risk all the way to very low risk from fire.
So by relocating the fire appliance, it'll improve the level of fire cover for some very high and high risk communities. Obviously, moving the fire appliance will see some communities with an increase in response time. These communities that are affected are currently, we believe, at a very low risk of fire in those communities. So although they're going to see an increase in response times that they'll be provided with will still be within the Fire Authority approved response standards. So that's important to know. So although there may be an increase locally, they're still going to be within the approved standards set out by the Fire Authority. And what that means basically is that means that fire cover in the Cleckheaton and surrounding areas is going to remain consistent with fire cover across the rest of the county, across West Yorkshire. It's also important to reassure you at this stage that the relocation would not see any reduction in firefighter numbers or staffing levels. So currently Cleckheaton employs 40 firefighters. They'd be relocated to Cleckheaton with no change in staffing levels or firefighter numbers. And we'd see no reduction in our fire appliance numbers across West Yorkshire. So we continue to operate out of 40 fire stations across 46 fire appliances, so there'd be no reduction there. As I pointed out at the start, it's really important, and we've got a duty to hear the views of the public and local communities on such proposals. So at this stage, we're just seeking approval from yourself to progress into consultation, to hear the views of the public and get their feedback so we can report that back to you in the next Fire Authority meeting. So at that stage, I'll take any questions, Chair.
Thank you, Nick. Again, I'm looking at time. I do want to try close the meeting at 12 at the latest. I'm not going to hurry anybody along though. Got a question. The first one I've got flagged up here is Councillor Pollard.
Okay, thank you. Yeah, the overall risk and response times from this proposed move seem perfectly fine. Just one minor point. In the event of a major RTC on the M62, is there any significant issue there in terms of speed of access to that specific sort of situation?
No, I think in terms of the sort of like local noise that we've got on the road network, that Berkshire does have very good access to the M62 as well. In essence, the technical rescue vehicle that attends the major road traffic collisions on the M62 would have an option to access at 27 and at 26 if it was located at Berkshire. So it would actually improve access to the M62 in all directions.
Thank you.
Okay, Councillor Curtin.
Should Cleckheaton be moved to Berkshire if it would affect the response times to Bailey Bridge? If Bailey Bridge was there.
Councillor Curtin, your microphone is, we can't really detect. Do you want to try that again?
Yeah. Hear me now?
Yeah, that's better.
Thank you. Should Cleckheaton be relocated to Berkshire if it would be more effective and improve response times if the from the station?
Nick, did you catch that? David, Councillor Curtin, I didn't catch most of that question.
I think I was struggling to hear the question. I did hear a comment regarding Bailey Bridge. All I can do at this stage is just reassure all members that the fire cover for all surrounding communities has been assessed, and the fire cover remains within our response standard for all communities affected. It isn't. We're not just looking solely at Cleckheaton when we do our analysis of what this move means. So we've looked at all surrounding areas and which appliances respond there and the effect it's going to have. So I'll provide that reassurance, and I'll probably take any further questions from Councillor Curtin offline if he wants to follow up on the specifics.
Yeah, I just thought it might be more effective if the Bailey Bridge was served from the Odsal station, as it's only up the road.
Yeah, and I think that'll probably be the case. I think that the way that our fire appliance mobilisations work, Fire appliances aren't a static thing. They move around the county, training and providing fire cover. The mobilising system chooses the nearest fire appliance. So it is dynamic. So although we do modelling when they're based at fire stations, the reality is they'll always get the nearest fire appliance no matter where that is coming from.
Okay, just one other comment, if I may, Chair, and that's the M62 was mentioned, and I believe I think the M62 can be easily served from the new Rastrick fire station as well, I believe.
Yeah, that's correct. So we've got a number of stations that serve the M62, Rastrick, the Cleckheaton, whether it's based at Cleckheaton or at headquarters, and Morley. As you move down the M62, we've got a number of different appliances that are well based to get onto the M62. That's correct, Councillor.
Okay, thank you, Chair.
Thank you. Yeah, I mean, some of this will come out hopefully during the consultation as well. Councillor Sunderland.
Thank you, Chair. So in February, we agreed to spend the money, and by now, in the middle of a national pandemic, we've made a very compelling argument for change, to change our minds. Is that just a process thing that we decide we've got the money and then we decide whether we want to do something, or has something else changed? That's the first question. And the second one is around the numbers about development. So there's a significant amount of additional business development and over in excess of 1,000 homes being planned for around the area. So are the numbers that you've used in the report the ones from the local plan, or are they current as they are now, number of properties on the ground? And then the third one is around the technical rescue unit. So I don't expect a full answer now, but when the report comes back to the authority, can we have some pretty detailed stuff about how that rescue unit is going to work and access the M62? Thank you very much.
Okay, so I'll take the first question, and then Alison may want to support me in this. We carried out a feasibility study against our stations and estate to understand where we needed to invest capital. That was put in the capital plan. The final approval to commit and spend that money would come back to the Finance and Resource Committee in any case. So there's opportunity to review that plan and the expenditure, and in reality this will be a saving for the Fire Authority. What was the second?
Just about the new homes.
Yeah. Oh yeah, the new homes. So yes, Councillor. So with regards to the new homes, the numbers in the report refer to the existing building stock. So that's we calculate risk based on low super output area. So we look at the existing building stock and we look at previous incidents as an indication of risk. We do take into consideration new developments and changes to risk as we move forward. That's the whole ethos of integrated risk management planning, is to make sure that our resource deployment aligns to risk as it changes. What we do tend to find, and we've provided sufficient or numerous reports to yourselves, is that our assessment of risk in terms of fire shows that there's a real close link to deprivation, and deprivation is closely linked to poor housing standards. So we do tend to find that it's the actual older homes and older properties that are run down and not maintained where the risk is increased significantly. Newer properties with better compartmentation, smoke alarms tend to be much safer. I think alongside that as well, what we're not suggesting here is that the location of our response arrangements impacts directly on our prevention and community safety work. So the community safety and prevention campaigns that will be undertaken in Kirklees will focus very much on new developments and new homes as well. So that service will still be delivered and sustained in those areas. The question about the technical rescue vehicle and the access and the incidents that they respond to, that is a county-wide vehicle. It responds all over the county. I think in reality, on average, they respond to about 150 incidents a year to the crew that staff that vehicle. So yeah, I think, as you said, we can get into more detail if you like during the consultation on that.
Can I just come back on the first answer? So in February, we took a decision to spend £2.9 million, and 4 months later, in a national pandemic where people have turned themselves inside out, we're now deciding it's a money-saving exercise. Is that right?
I think if I can come in there, Councillor Sunderland, I think in terms of the capital programme that was approved in February, then we allocate a level of money associated with either refurb, rebuild or relocate in terms of where stations in this particular case may go. So obviously the approvals that were put in place for Cleckheaton and a number of other stations within the county, such as Keighley, Halifax and Huddersfield, were part of that overall capital programme. In terms of doing that evaluation of the existing site, particularly for Cleckheaton, means that looking at that, because as Nick's outlined, it's not just the fire station, it's also our technical rescue capability. And as part of that technical rescue capability, we've got urban search and rescue, which is a national resource that can be deployed anywhere in the UK if there's a major incident. We receive something called Section 31 grant direct from the government for that resource. So at the minute, all of the urban search and rescue assets are located at Birkenshaw. So as part of the overall review for that station, we've looked at it, as Nick has outlined, as a IRMP, Integrated Risk Management Planning exercise, looking at where are our stations better located. So when we've looked at Cleckheaton, we can't house all of our facilities at Cleckheaton on that site because it's too small. I think from a risk point of view, we've looked at that, and the analysis that has come back that station would be better sited here if that is possible. Obviously, this is about going out to consultation to the public to see what their views are. And overall, there's a net benefit for those, particularly who are at higher risk or high risk in terms of their vulnerability and susceptibility to fire. And then obviously the off kinds of shoot of that is that we, or you as an authority, in terms of public money, potentially make savings of somewhere between 1.6 and 1.9 million with the sale of the existing site as well. So I think in terms of efficiency, effectiveness and how we treat our people, then we've looked at all of those kinds of parameters, and this appears to us as officers to be the best solution.
Thank you. I'll just say it feels a little bit chaotic in 4 months, but thank you.
Microphone's on mute, Chair.
Sorry, thank you. Councillor Hall.
Thank you, Chair. The case looks really really compelling, actually, as it's put in the paper. There's bound to be local concern about this in the Spen Valley. There's always local concern if you're even moving a fire station, as we know. And that's why I think it's important that we really go the extra mile with the consultation on this. It's going to be hard to consult anyway under the present circumstances, so we've really got to put the effort in. And the consultation must explain to people that there is negligible risk or negligible increase in risk, negligible impact on people that live in the Spen Valley. I have one concern, which is social media. Personally, I am not a fan of social media and never have been, but it does play an important part these days in informing people, particularly when people are restrained to their homes. But the one thing that does happen on social media is that hairs start running, rumours start abounding, and I personally think that the authority ought to keep track of what's going on social media and prepare to correct any erroneous rumours should they crop up.
Yeah, okay, thank you, Councillor. I think it is fair to say we're going to commit significant resource and time to the consultation. We've got an officer dedicated in our strategic development team and an officer in our communications team dedicated to that. We recognise it's going to be challenging given the current situation. I think some of the changes that will take place on July the 4th will just help with more safe but limited face-to-face interaction if that is needed. We're working closely with the Kirklees Council to understand what groups we can access and how they're meeting and who we can contact with that, and we'll welcome Council's support in gaining that access to the community. I think in terms of the social media, yeah, it is something that we recognise the benefits of, we'll be using extensively during the consultation. And we also have a system in place where it's monitored on a daily basis through our communications team. So that's monitoring all the different social media platforms, specifically around the Clegg proposal, to help us understand the interaction that we're getting. And also, as you say, we can provide factual information to counteract any scaremongering or misinformation that may be peddled on social media.
Thank you, Councillor Hall. Councillor Austin.
Thanks, Chair. I am mindful of time and I know we haven't got long. Thanks for this, Nick. It's very informative. I just think that the Fire Authority has always been very good at consulting, and I know that today we're just making a decision on going out to consultation. So would it be wise that we move to a vote to say that, you know, we're happy for it to go out to consultation and all the questions that the other members have got can be fed into the consultation?
Move it, Chair, move it. Yeah.
Well, thank you. I was just going to go to Councillor Graham because he didn't intimate to speak, but Councillor Graham, if you're happy with that, I'll move from the chair, then we go and approve an 8-week consultation around the relocation of Clegg Fire Station up to HQ, and we'll ask, you know, I will take responsibility with officers to make sure that that comprehensive consultation that Councillor Hall and Councillor Sunderland mentioned does indeed take place. I think Clegg has been on the horizon for some time. There's a number of stations and that have merged and closed and moved, and I think the age of Clegg has meant, from what I understand, that this was on the agenda for some time, and it was something that we needed to get to. Sorry, I'm going to bring in Councillor Downs. My apologies, Councillor Downs. I did forget to bring you in. I've just seen your intimation there. Councillor Downs, you want to come in?
Yeah. All I was going to say, I won't say much more because there's now been a proposal to go out to consultation. But my concern was that, being on the Resources Committee, it hasn't come to us first. We were approved in the February meeting that we would spend 2.9 million, and now we come to the AGM to find that that's all changed without any sort of reference to members, so that we're not fully genned up on it. And obviously I would like a full briefing on it, but we've not had that opportunity before we've then said we'd like it to go to consultation. And I just find that disappointing.
Can I just answer that question? So I think Nick's already mentioned this, but before, this is just a consultation today, so before we make any decision on this, it's got to come back to Finance and Resources Committee anyway, with a full business case and a full plan with financial implications.
Yeah, I get that totally, and I haven't got a problem with that side of it. It's just that I would have expected, the fact that we've been in lockdown, it would have been nice to have had either a special meeting of the Fire Resources Committee to actually just brief us on this before it came out, so that, I mean, some of the public are already aware of this, and I find that disappointing that we didn't get the opportunity to see the options to perhaps comment on them, to perhaps have an input before the consultation, whereas now we're just like treated as members of the public, in that we're part of the consultation. We haven't had a chance to shape that consultation. That's my point.
Okay, thank you. John, Dave, Nick, can we arrange you know, a bit of a wider briefing as soon as possible for members?
Yeah.
Yeah.
Yes, Chair. So, yeah, I think what Councillor Downs refers to there, we will commit to an interim meeting for members to brief them on the initial findings of the consultation and give you opportunity to understand the business case and the proposals in good time before the Fire Authority meeting in September.
Yeah, I think given the consultation is about to start, I think I'd like that wider briefing to be next week. If Nikki, Michael, we can, you know, try pin that down for next week if there is member availability for that. Maybe we need to do 2 to cover to cover all members. I'm just keen to do that before we get too far into the consultation, if that's okay.
Yeah, that's fine, Chair. We'll pick that up.
Okay. So unless there's any other comments or questions, I will take a general consensus, general assent that we approve that we can go to an 8-week consultation around the relocation of Cleckheaton Fire Station up to the HQ site, and we will ensure that that briefing takes place, and bearing in mind it will come to FNR also as well. So everybody generally happy with that? I'm just going to click and make sure that we've covered everything in there. So I'm happy to approve that then. I don't see any comments or questions that says any other way. So we approve that to move to an 8-week consultation. Thank you, everybody. To finish off then, item number 14, the Corporate Health Report 2019-20, to receive our statutory annual update. Is that you, Michael, on that one?
Yeah, very briefly, Chair, you'll see that compliments and complaints are both down, but in the case of complaints, they're down by 56% to a very low 24. We have an annual customer service assessment carried out by an independent individual, and we are assessed as in full compliance with all 57 of the criteria used. And we are compliance plus now in an extra 3, so that's 20 out of the 57. And you'll see at paragraph 6.4, the inspector recognises that we are recognised nationally as a centre of excellence. There haven't been any ombudsman or whistleblower complaints. That's it, Chair.
Thank you, Michael. Any comments or questions from members? Let's have a look. Councillor Shaheen.
Thank you, Chair. Just in regards to on page 49, just looking at the table there, attitude and operational, even though I take the point the numbers have gone down, we are still on number 6 there. So what are we actually doing to make sure that number goes down as well? And then on page 51, looking at the injuries, it has gone down immensely, but still there is still a substantial number of injuries. What are we doing to make sure the place is actually safe and we try our very best to reduce the number of injuries? Thank you.
I've got the second bit. I can get the first bit. I can deal with the injuries, but
the first bit. Yeah, Chair, it's no Walton, if I can take the first bit, please. As regards the complaints received, which I think Councillor Shaheen was referring to, there's a total of 6 there. I don't have the specific details in front of me at each and every one of those. Members may rest assured, though, that as and when those complaints are received, we will look into the circumstances of them. Clearly, it's not in every case that just because someone complains, it has grounds to it. But we would look at that, look at the evidence, and where we feel that it's appropriate to put in some sort of corrective action or guidance for our staff, then of course we would do that.
Chair, if I deal with the second question, which was about the accidents, we have a very active and engaged health and safety committee, which I chair and has representation on from the joint trade unions. I think the nature of our business is that we are going to get injuries to staff from time to time, but clearly we seek to minimise those injuries. We encourage staff to report any serious incidents and any near misses. We review every single report that comes in, and we set off pieces of work to make sure we learn from any incident where learning is appropriate. What we can see over the last 2 or 3 years is that the number of accidents in the organisation has fallen quite dramatically, but it is a matter that we keep under constant review and is reported to every to every HR committee meeting.
Okay, thank you. Is that okay, Councillor Shaheen?
It is. Thank you very much.
Thank you. So, yeah, well done to officers involved in all of those compliments, and thank you to everybody's time and efforts throughout this year. I mean, I know we do this in the new year, and we do it at the end of the municipal year, just to thank everybody for their efforts and time and dedication to what we do here in Kirklees collectively. I think where there are complaints, I'm pleased to see such a small number of complaints, and I think from members it's just that hope and that wish that there is some learning in place and evidence, where there are those complaints that are being upheld, so we don't see recurrences of some of those complaints. I'm just going to click one more time. Councillor Harrand?
Yeah, just underline stress that 24 complaints over a year with over 1,000 employees going out into the community is an amazing, phenomenally good result, and any suggestion it's anything less than that shall be derided. This is brilliant, and thanks to everybody concerned. No hesitation, 100% support. This is what we would hope for, best ever, I'm sure. So let's not be negative. This is very good.
Thank you, Councillor Harron. Absolutely. Thank you for those comments. Well, if there are no more, I'm just going to check the chat one more time. Yeah, so that's just for noting. Is that annual update or receiving, I believe. So with that, I will thank everybody again for their efforts this year, and I look forward to working with everybody during this next year. Have a good day, and we'll see you again soon. Thank you.
Thank you. Thank you.
Thanks. Bye.
Thank you.
Thank you. Thank you, Chair. Thank you, everybody.
Bye.
And thank you to the public for listening.
Thank you.
Thank you.
Thank you.
Bye.
Goodbye, everybody.